face with you. All right. You're live, so I'm gonna duck out now. Have a good stream.
Bye. I think I'm live. Yep. Hey, everybody. I am so sorry. We were having so many technical difficulties today, and there was a question uh, of are we going live? Are we not going live? A bunch of issues came up that was way out of our control. Then I had serious technical issues, and I see Melly here. Melly, we're usually really good at this. On time, 5 p.m., Parham and I. But he had an unexpected situation come up as well. And hey, Nicole, we had all kinds of issues today. Parham had some sudden obligations, and then now I had major problems with getting on because my desktop camera went on us, and then I'm on my phone now. So I guess I'm sorry with everybody, but it was a great topic. But we do have Melly here. I don't know how many people are on. I think just Melly. Usually we have 30, 40, 50, 60 people on. So I don't know what we should do. Nicole, you want to pop up here and chat? Hey, Brandy. Sorry, we just had a really multiple issues happen today, including technical difficulties and sudden issues that came up for Parham. Hey, wow, everyone's still coming on. Very cool. Uh, yeah, I mean, it's up to you, but I can't. I'm using my cell phone, which I've never used before because of the technical difficulties, and I even goofed up the TikTok announcement because I didn't put a title on it. So it's been a, it's been a weird afternoon. Anyway, we could start discussing this, and I can let me put this phone right here. Uh, Okay. I think everybody could see me. And I can't tell how many. Nicole, is there just. Oh, there is some people on here, huh? Yeah. Okay, guys. So today, again, I'm sorry, and Parham sends his. Oops. Can you see me? Okay. Jeez. Okay, so again, I'm very sorry, and Parham also sends his best. He had an emergency, and he couldn't make it with us today. And I had a whole bunch of technical difficulties beyond imagination. But let's move forward and carry on. Good. Let's discuss the topic, microdosing. Okay, so I don't know how much people know about it, and what they think about it. But I started to see a lot of it on my channel on TikTok, and everyone was referring to it. Okay, everyone was talking about microdose, microdose, and microdose. And this was some time back. I mean, I already knew about it, but I just sort of didn't really pay too much attention to it. And people kind of kept asking me, and I've actually changed my mind a little bit about it now. There's some interesting things with it. Number one, in modern times, I think it really started with a researcher doctor up in the Bay Area, Silicon Valley area, and I can't remember his name now. He's a pretty cool guy. In fact, let me look up his name. He published a book called uh, let's see, what was the book called? James Fadiman, yeah. James Fadiman. He, in fact, published a book on it. And he was doing this research. James Fadiman is traditionally a guy who is a researcher with psychedelics, psilocybin, mushrooms, LSD, all that stuff. And he usually has always dealt with recreational doses. Okay, I don't know how he came across this idea or this concept. I think in discussion with one of his colleagues at one point, and they brought up the concept of microdosing, which is essentially 1/10 to 1/20th of the usual recreational dose. And there's some history to this stuff, which I'm not super familiar with, but there's some history to this stuff that this kind of dosing has been around in effect and in use with indigenous populations forever. So he started messing around with this whole thing. And again, keep in mind, this dose is not meant to be euphoric psychotropic episode, right? That means you're not taking a drug to have a good time, okay? And that was, and some research was, I think, being done in the late 90s, early 2000s. Well, from that point on, Bay Area, Silicon Valley, till now, this stuff has just exploded. And partly because of the fact that information can travel so fast via the internet. You know, it went to the East Coast and now worldwide. And, you know, hundreds and hundreds of thousands have started to use this stuff. And in fact, the dosing that they use is the dosing that he was utilizing for the studies that he was sort of conducting. Now, all of this, some interesting, yes, LSD and psilocybin, mushrooms, okay? Now, all of this has had some really, really interesting and paradigm shifting, hi, Rochelle, outcomes. And I find that just as interesting as anything. Besides the fact that there is many, you know, don't forget this stuff is illegal, but besides the fact that there's this citizen-like community out there that is doing everything from creating boxes that you can keep this stuff in to sort of, you know, a friend that you can do it with for the first time, giving you recommendations on dosing, how to create the dose, how often to take it. In general, what has been observed is that it is sort of a mood enhancer, I guess. Okay. You know, I've heard it described as, you know, if you take an SSRI for depression, the depression is still there, but the SSRI helps you get along. But if you use microdosing of psychedelics, you're actually in a good mood. So mood enhancement, creativity, and through this, other things have also come out. But let me back up and tell you what I mean by through this. There really hasn't been what we traditionally call large randomized controlled placebo studies that, you know, we as clinicians or the scientists look for. And this has really been a natural grassroots phenomena. And I think James Fadiman called it citizen science or something like that, which I found fascinating because everyone, the folks that are out there doing it are giving thousands of points of feedbacks, like, you know, it helped me with this, it helped me with that. And now they're trying to semi-formalize this by sending out questionnaires and so forth. In fact, there's a psychologist in Sweden doing it. I think Fadiman himself is doing it. And it's a really fascinating phenomenon because although it's not under FDA regulation, and in fact it's illegal, they're out there and they're creating some structures. Like, for example, if you're bipolar and if you're in a manic phase, don't do this. Okay, that's kind of interesting. And then there's all the other reports coming back, which may hopefully lead into more rigorous studies. They're talking about it for Alzheimer's. Okay. They are talking about it. I saw Fadiman pointing this out. There's been 2 or 3 case reports, not true case reports, but anecdotal case reports or citizen case reports. We can come up with a new term too, where this has helped with shingles, herpes zoster lesions, which are extremely painful for many, 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 many months. And so that's what microdosing is. That is what is happening. Depending on where this goes, it may change the paradigm of what we consider good science. I don't know yet. I'm going to sit back and watch with some caution. But that is what microdosing is. It's gaining popularity, but at the very least, we are starting to see real structured studies at academic institutions, and we'll see where it goes. What is interesting about psychedelics is that, if you go back 70, 80 years when this stuff was sort of discovered by Hoffman, and if you follow the history of it, coming up all the way to Nixon and, the guru of this stuff, and I can't remember his name. This stuff was under intense research for therapeutic purposes for a lot of mental health issues. And that research just got shut down for no other reason than, well, there was some reasons, socially motivated by the powers that be. But now, hopefully, maybe we can open that research back up. That's my introduction to this stuff. Now, as a couple of other ideas that I just want to put out there is that, this stuff binds to the serotonin receptor, and it binds much more tightly than serotonin. And apparently, it really, I think the expectation was, I was reading somewhere, the expectation was that once this stuff binds, it's just going to fire everything up, right? Because you have such a vivid, disassociated, open experience, or you can have one, in the case where you're actually using larger doses. That being said, as it turns out, there's a large chunk of the brain or a particular system in the brain that it actually shuts down. And that makes sense. That part of the brain, which is a connection between the frontal cortex, prefrontal cortex, some of the more historical structures in evolution that control mood regulation. If you look at that system really, if we can put a physical connection to it, that system really describes the classical psychoanalytic and psychodynamic ego. And it really dampens that system down. And when I read this, I thought it was really, really fascinating, because that self, that sense of ego, that identity, that personality that you develop very early on, and there is a rigidness to it, relatively. If you have a personality disorder, that rigidness is 100 times worse. There's a rigidness to it that you see the world through the lens of that self, using the term loosely. And that really is defined by all of the experiences that you have during the development and the world that you live in. And it's sort of, we can even say, biases, prejudices, our cognitive dissonance of false beliefs. And it sort of seems to break that down, or tone down that system, and allows all these connections to occur. Otherwise, and allows you to see the world through a new lens, right? Which is interesting. That's why You can see what you would normally hear, have what you think are insightful thoughts about people, humanity, friendship. And in some ways, this was probably the thought that you had at the age of 1. And finally, I want to say this idea, and I'm not talking about microdosing there. I'm just talking about we know very little actually about the mechanism of psychedelics, except that they fire up the serotonin receptor like a vengeance, and after that, downstream something happens. Interesting, right? We don't know much about it, but this got me thinking. It could potentially be used in conjunction with psychoanalytic methods. It could potentially be used in conjunction with those methods to attempt to treat some personality disorders. In particular, I'm thinking cluster B and narcissism, which is so rigid. So, a drop or a hit of acid can potentially loosen that rigid sense of self that is so pathological in those people. And with some guidance from a professional, it could lead them to the right place. Those are my thoughts on that, guys. Let me see which guys are writing. Nicole, if you're around here, you can help me because I'm not too good at. I'm on the phone. Hi, Michelle. Thank you. Oh, thanks, Brandy. Yeah, sorry we had such a rough time today. Yeah, Nicole, help people get on and ask some of their questions because I'm having some issues with this. Hey, Karen. Yeah, Powham will be back with us shortly. Hi, Debbie, Brandy. Brandy, I see the depression comment because, this stuff could potentially be explosive for mood disorders, right? Hey, Germany, what's up? Free Ukraine. Oh, you're driving, Nicole? Okay. Okay. Here's Deepak. Dr. B, can you get subscripts by mail now? I mean, if you're in the state, or if you're a patient of someone's, yeah, the pharmacist can mail them. Yes, I think so. Microdosing psychedelics. Mainly, I'm talking about, Doug, I'm talking about LSD and psilocybin products. I'm not speaking anything beyond that, even other psychedelics. Hi, Rochelle. Yeah, you talk about naltrexone microdosing, and it's been used, I think for the most part, it's been used in studies, whether it's multiple sclerosis or a few other really painful syndromes. And, I don't think much has come of it yet, Rochelle. And these are pretty small doses. I don't think much has come of it yet. It's certainly not something they market and it's out for public use. So I suspect, excuse me, the data hasn't been so promising with them, but I'm not 100% sure. Brandy, what worked for you? Naltrexone or shrooms? Queen Victoria addicted to alcohol, opium, cannabis. Okay, there's Cash. Hey, Cash. I had major technical issues today, and Parham had a emergency and he's out. Yeah, so the other side of life, just so you know, PCP is a disassociative, and I don't know if people know this. It's the same family as ketamine. LSD is different kind of drug class, although you can have a dissociative effect with it. And with PCP, you could certainly have a hallucinogenic effect. But if you look at LSD and psilocybin, yeah, they hit the serotonin receptors, which is where we're talking about the SSRIs increase the serotonin in the junction between the two neurons. So yes, it is kind of true. The other side of life. Uh, I hadn't heard of. I, yeah, Brandy. From I understand what you're saying, and I've become a lot more soft on it since I've been doing somewhat a lot of reading on the microdosing phenomena with psychedelics, and if that's what we're talking about, because it's not, it's it's we're a long ways away from saying it can treat depression at those doses, but it certainly is a mood enhancer. That being said, when you read, excuse me, what people are saying, it's not getting them high. Okay. Um, and a lot of these guys, it seems to be the hip thing to do in the Silicon Valley. Uh, Yep, MDMA used to be used for psychotherapy. By the way, MDMA, just so you know, it's a empathogenic. They often say about it, but it is methamphetamine class still. So it's interesting because these drugs, um, the classifications that they have, they don't all necessarily fall exactly under that as a stimulant. For example, MDMA, it is an empathogenic and has a lot of euphoric qualities to it. Yeah, we do need I agree with you, Freedom. Yeah, I'm reading. What do you think about ketamine, MDMA induced talk therapy instead of using classical psychedelics? Tryptamine, like drugs such as psilocybin, mushrooms, DMT. I think on a couple or all of that research is underway right now, and it's looking promising. I haven't looked in detail into which one and how good it's looking. But I remember, as far as 10-year backs, I was checking it out. I'm trying to move down. Daddy Deal microdosing is doing LSD, correct? Yes, Daddy. It's LSD or mushrooms, psilocybins. And the idea is you do 1/10 to 1/20th of the dose. And in fact, yeah, and that's sort of the big thing everyone's talking about. So we thought we'd come in here and sort of give some life and discussion to this issue. Cash, hi. Hey, John. Padam's not here today. Uh, he had an emergency and he apologized. And hopefully he'll be with us next week, but he will be back and he had to attend to this. Carrie, I see this not now truck something for weight loss, and I've never seen it or heard of it, and I will check it out. Yeah, JT, it's kind of funny you're talking about that because I was just thinking about it. JT says, I didn't have those thoughts at the age of 1 when I couldn't analyze my surroundings like an adult. Well, what I'm talking about is, yeah, you're not necessarily conscious of those developing thoughts, but I think what you said about narcissism is interesting in the context of a guided professional. Yeah, I felt like it was a eureka moment when I thought of that, JT. And I might send a couple of emails out and do a literature search. Once I started reading on the fact that psychedelics kind of suppress certain systems in the brain, and actually one system in particular. And that system, if we were to put it into psychological correlates, uh, it's, I guess, loosely we can call it the ego, the self. And it sort of intuitively makes sense to me because our self, our ego, our sense of who we are is really dictated by and formed by all of our experiences, even from pre birth, with some mixture of our genetic predisposition and so on. Now, we also know it's extremely difficult to get outside of that world view or paradigm. Uh, and it seems like, excuse me, psychedelics loosen that grip up. If that is true, and if those parts of the brain have as much to do with the formation of, or what the self is, and hence the formation of the self, what can we utilize it for, as far as what can we utilize psychedelics for in conjunction with psychoanalysis of any form? I'm talking about therapy, to be able to make someone who's a narcissist relax under rigid stronghold worldview that is based on false presumptions and really a creation of their they interact with the external world, but they don't interpret events like somebody else does. And what is the possibility of creating empathy in them? And that's what I was thinking, JT. So I'm going to send a couple of emails out and see if I get laughed at. Yeah, Cash, there's that. It's just, and I'm not going one way or another about it. I'm just sort of exploring what this stuff is. And we'll see how it pans out the next couple of years. I need my glasses, guys. Hold on. Let me put you here. Oh, I can see much better now. Okay, Kat, Real Talk Recovery. She says, let's look at this naltrexone thing. Sorry, I'm really curious. Okay. I can't. My internet's shitty. Okay. Dr. B, what can you tell us about mephedrone, I presume? Look, mephedrone, I think that's what you're asking, Vincent, is a synthetic cathinone, which essentially means synthetic stimulant. If you remember, uh, the earlier first generation stuff was bath salts. The second generation group was one of them was Flocka, which I think I made a video about. And these all, uh, 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 the shape, the chemical shape of these is like this thing called cathinone, which is the active ingredient in a bush and a shrub called gat or cat, however you want to pronounce it, grown in North Africa and some of the Arabian Peninsula, and it is a stimulant. And I guess what I can tell you, Vicent, about mephedrone, if that is what you are asking, is that it's bad stuff potentially. If that's what we're talking about, it's a recreational drug, and this stuff can really, really, really hurt somebody. I hope that helps, and I hope that's what you're talking about. That's right. LSD is not really addictive. Is there an abuse potential? Sure, there is. I suppose under some circumstances, but in general, um, let me put that differently, so I'm a little more careful. Um, is there people that abuse it? Yes. And do they suffer the consequences? Yes. Um, but is the abuse potential as high as something like heroin? No. Yeah, so it is actually on John. It's on label for alcohol, and that would be naltrexone, the 50 milligram tablets, and it's actually one of the first things that this stuff was indicated for. Let's see what else he wrote. Now, as far as the cocaine goes, it would be off label. Ouch. Sorry, guys. I'm trying to shut these doors here. Let's see what else we got. Now, one of I think I muted myself here. Sorry. Uh, can you guys hear me? I hope so. Yeah, JT, I hope that helps. Again, everything I said there is purely speculative. I'm just totally guessing. Yeah, Brandy, you brought up healing from traumas. And I would say, I was just having that discussion with a patient today, and I would say uh, that is something that you have to work at every single day, because what we're talking about here is neuroplasticity. Oh, I'm back. Sorry, I don't know why it lost me. Crappy connection. We're gonna do this from somewhere else next time. Look, Brandy was talking about healing from trauma, and here's what I have to say. Think about what we're talking about now. Whether it's childhood trauma, adult life trauma, something that was significant enough where it's turned into a complex PTSD. Okay, and what I have to say about that, once you have complex PTSD, to the best that I understand it, there is actually a significant amount of changes in your fundamental architecture. Remember neuroplasticity. So let's take an easy thought, and let's say your trauma was as a child. And if you think about it, it really bothers me. And there's a very important person in my life right now that's quite young. And people say, oh, don't worry about it. He's resilient because he constantly adapts to what's pathological, abnormal, inappropriate. Okay, and I say to them, here's what's actually happening. When they say kids are resilient, they adapt. Humans are resilient, they adapt. Except here's one thing: the data and literature is clear on this. Okay, when he's adapting to what is abnormal, that's a survival mechanism. And he's using frontal cortex cognitive almost fuel to cope. And so that's what's happening now. You were able to cope and adapt beautifully as you age. Your systems, and again, this is sort of analogous, an analogy to make you think about this. Your systems start to, imagine being on revving on, 8,000 RPMs from beginning to for 20, 30, 40 years. Now you're doing that. Well, shit starts to break down and things start to come out somewhere else. Okay. And so you were able to cope so you were able to cope with a pathological imposition on your life. Okay. Now you don't even know what normal and healthy is. But at the same time, those of you that are in this stages of recovery, and moving away from substance abuse or not, but there was trauma. Now you have to work every single day, whatever methods that you're using, to get to a place to recover and deal with life's stresses in a positive way and stop seeking out situations learn how to stop seeking out situations where more trauma is induced. Yes, Brandon. Yeah, they're resilient, and uh, it really pisses me off when I hear people say that. Resilient, why should a 2, 3, 4, 5-year-old have to be resilient, right? He should use those cognitive, emotional, behavioral resources during development to get the right nourishment. Why should he have to be resilient to make sense of really messed up stuff? And that's how I feel about that. Yeah, keep at it, Bandy. You will get there. Sure, other side. Just kind of through this. Your name is so long, it's difficult for me, especially with my ADD. Yeah, I like this conversation's sort of going from microdosing to trauma and development, and which is for me right up my alley in some ways, because I look at substance abuse, nothing more, absolutely nothing more than one of the pathological outcomes of that resilience and coping with shit for so many years. Now you found a warm blanket, a safe blanket, a place to hide. And that can't work. Hey, Debbie. Thank you. Yeah, this topic has sort of become, I started my whole practice on some of these issues. And fundamentally, people think of me as the MAT guy, and what a lot of people don't realize, we've sort of blossomed into an internal hub and spoke organization, which that means is that we've created our own internal reality for all of our patients and so forth. Why? Because a monkey could give you a prescription, and the foundation of my whole practice is substance abuse is just one of the outcomes of pathological childhood trauma or later trauma, and pathological social constructs that we have created. So, and a lot of people don't know that about me, but that is my position. Cool neighbor? Who, me? Thank you. I'm sure you're a cool neighbor. Yeah, Candace, I see a childhood trauma with that. Me over the edge was a POM PE at 21 now. Medical anxieties by far the hardest to deal with. Yeah, medical anxiety. In fact, that PE probably caused you some trauma, right? And being in there, and the possibility of, I don't know how bad how big the embolus was, but that's really, 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 really scary. Oh yeah, when the body says no, that's Mate. Yeah, I know. I haven't read it, but I do know of that book. On average, how long does restless leg syndrome last after Suboxone taper? Look, Candace, my position is depending on how quickly it started. I always think the taper should have been a little bit slower potentially. How long does it last? I can't tell you, depending on, I would say several weeks or several months. But again, I don't know where you are, how quickly you tapered, and Requip is one of the drugs for it, but it's a real nightmare, and I really empathize with you. I hate when I hearing about that. Hey, it's the caring pharmacist. Let's see. I've seen a couple of recent studies using microdosing of subs for the induction phase rather than the approach of requiring complete abstinence for a period of time. What is your opinion on this? If I understand it correctly, they're just starting with tiny doses, and then while looking to see if the person's, if I understand you correctly, and I got to look at the studies. I don't want to put my foot in my mouth, but I don't necessarily, unless if the outcome's going to be better than doing Suboxone the way we do it, traditional induction and stabilization. I'm wondering why they're doing this. But you know what? I will go on PubMed tonight and look it up. And if you have any identifying things you can send me, I'll check it out. And what about inherited depression and anxiety? My kids have it. My mom has it. Yeah. Well, you know, I think in all of this stuff, there's always a component of predisposition. And if you notice, I'm not even putting any genetic labels on it and so forth. And let me tell you why I'm not doing that. We often underestimate the contribution of the environment that tiny little thing is coming in, and sort of what it's feeding on from its environmental cues early on. Let me see if I could describe it for you, right? And that's why the concept of genetics, nurture versus nature, is so complex. And most people think it's categorical, this or that. It's not. But, you know, let's say a kid comes and grandma's depressed and mom is depressed. And in that milieu of the whole family being anxious and depressed, he is going through, being in mom's belly, right? Which changes the dynamics of the stress hormones being fed to him. Then out of the belly in those early, very infant early times. And he's also around that anxiety and depression. And I'm making it as simple as I can, but I think all of those contribute to a predisposition, and it's not necessarily heritable. So I'm going to argue, and I think justifiably so, that even that can be mitigated and changed. It's a lot of work, and you can't always do it, but certainly there's got to be an avenue to tweak what is meant to be. And that's my thoughts on that. Yeah, you got to quit Coca-Cola. I agree with your doctor 100%. That is a very simple carbohydrate, sugar that is quite toxic. All of that stuff is, all of that. And in fact, for what it's worth, I have pretty much changed my diet in the last few months, where I've put away all sugars. And what I mean by that is synthetic sugars, right? No added sugars in any of the products I buy, which I try to keep it very natural and close to the earth as possible. But if I want to get something and I see there's added sugar, I try to avoid it. That's how badly I think of it. So you got to keep trying it. And, you know, this stuff has a very strong grip in the same areas in the brain as a lot of substances of abuse. So you got to think of that. Oh, crap, I got 1%. Let me plug this in. Just barely made that 1%. And just so you guys know, I have about 11 minutes, and this turned out to be a lot of fun. I really miss Pat home. And we're not even getting to talk because I have no idea what I'm doing on this telephone, as I always have technical difficulties because I'm an idiot. But this is fun. Nicole, are you there? Wait, Brandy, how do you know I love peanut butter? Did you see it somewhere on my desk? Yeah, I'm a big almond butter and peanut butter fan. I just inhale that stuff. Melly, you're a new subscriber. I hope you stay with us. Oh, you got to put 6 or 7 cans a day, my friend. Oh, I did, huh? No. Yeah, I love peanut butter. Look, you can't drink 6 or 7 cans a day. You're basically blasting your receptors. You're just screaming for type 2 diabetes. Please cut down. I've had a couple of patients where we successfully tapered down and cut down, and you will feel better. You will look better. And you can't do that. It's just not good for you. I don't mean to scold you about it, but maybe if I put a little fear on you and if I put on my white coat, which is, I really am a doctor, guys. I got a white to get you to slow down. I hope you've slowed down. I like that, Jennifer. Rochelle, I'm actually been vegan for the last, if vegan means the one where I do no animal products, no processed food, no, uh, uh, yeah, no animal products at all. I've been doing that for about 6 months now. With a few, I wouldn't even call them slips. I don't feel guilty about it. But about 5% of my meals I have had animal product. Well, not animal products, but maybe whatever. But yeah, I like it. This is a lot of fun, guys. Nicole, where are you? I feel bad. We wasted quite a bit of time with my idiocy trying to get on, but I do have to go check on these patients that I have out here. I kind of like this. Missy, what state are you in? No, not really. In fact, the active ingredient in caffeine is methylxanthine, which is a bronchodilator, by the way. Sorry, guys, I have to take a little bite. Florida. Wow. I don't know how you got to talk to a doctor out there. I have some videos on that issue. Sure, Travis. I have some videos on it, but the only thing I can tell you as you search for a doctor, you have to find someone that understands how important it is to take their sweet time with that taper. That's key. And you want to do a cross tolerance probably. Oh, ephedrine. Well, who's taking ephedrine? Wow, this is, it is. watch my video coming out on ephedrine and Mao Hung. Thanks, Karen Farm. Send me an email on that stuff I'm looking for, please, that you told me about, and I'll look it up. Guys, I'm packing up as we're chatting because I have to go out there and see those patients before I leave. This was a great, a lot of fun. I promise I will get a new camera next week. Hopefully, Parham is able to come back with us. He's not gone. He just had sort of a big thing that he had to address that just sort of came up suddenly, and it was a major issue. And I love this topic, and I love everyone on here right now. Randy, let me get my glasses, Randy. Did I give it to you, Randy? I gave it to somebody. Then I'll do it, Randy. Iron overall? Do you have fear? Hey, where'd it go? Yes, Randy. I will give you 10 minutes, I promise. Topic for next week. I don't know, Debbie. What do you guys want? And I'm sorry, I've gotten so busy where what topic do you guys want? You want to all just, maybe Nicole could set something up? Sure, Rochelle. You guys want to set something up where you guys all, mushroom? We kind of, I mean, sure, we can. A little bit today. I mean, if we're going to do mushroom, it would have to be psychedelics in general. We can cover much more than that. We can do Suboxone. Sure. You guys have to decide. This is for you guys. And Parham and I can do anything. And if Parham's not back, supplicate, we can do that too. Or you can just ask a question no matter what topic we do. The point is in this quick hour and a half to be able to get you guys informed and send you off to do your own research as quickly as possible, guys. Mushrooms seem too dangerous. It's always, you never know what's going to happen. As paper, you knew exactly what was going to happen. Yeah. Again, thinking of depression, treatment, general drug addiction, you guys pick. If it was up to me, I would do a topic that would be called alcohol, the perfect drug for the narcissist, covert narcissist. And the reason I would do that is that the way the covert narcissist uses alcohol acutely completely describes every clinical effect that alcohol can have. Blue Moon, that's gracious of you. We try to always be here for you. So what's better, Subutex or Suboxone? Eli, I think it really depends on the person and what I'm trying to achieve. Okay. Thank you guys so much. Figure out what you want for next week. Thank you, Brett. And I don't know, I'll tell Nicole to put something up where you guys can get things up. Yeah, I do too, Brandy. And I might change them to a night where it's kind of better suited. I only get an hour every 3 months. It's $80 no matter what. Thanks for the free help. Sure. I that's not bad. $80. I have to admit. I mean, that's not a bad price. But look, you guys figure out what you want. Maybe Nicole and Austin could put a thing up, and I wheel up Monday nights too. Pyroman is very sad he's not here tonight, and I'm going to see you guys in a week, and I'll tell Nicole to put up some sort of a poll for topic. Cool, Randy. Good. Send another one, Randy. Oh shit. Yeah, Randy, I remember it. I remember it all now. Yeah, please send it again to Nicole. Please. Okay. What's okay? Steroids. What? I can do that too. God, you guys have too many fun topics. You guys pick. We'll get a consensus. We will eventually cover everything, folks. I really gotta go because these guys are yelling at me, and I never get any respect. Okay, guys, have a wonderful week. Be safe. Stay strong. Stay sober. Stay sane. Uh, Shout out. Yeah, sure. I think I know what that means. Shout out to Martin Moreno's buddy Omar. Uh, he's Martin Moreno. Okay, so I think I know what a shout out means. So a shout out to Omar, who is a huge fan, and his buddy Martin Moreno told me to say it. Oh, well, he's battling COVID. Stay strong and get your button in here on a Monday night. Modafinil, I have some thoughts on that as well. I have thoughts on too many things. Okay, guys, love you all. Peace, and I will see you all very soon. I got to go because you guys are too fun here. And let me know. Bye.